In the in vitro studies, which means in the test tube studies that have been done that look at the effect of artemisinin on cancer cells, what they have found is that it's pretty effective in killing those cells. In fact, with breast cancer cells, about 28% of the cells are gone within about 16 hours if they're cancerous. And if you add iron to that combination, it's more like 98% of the cells are gone in about 16 hours. So that's pretty powerful treatment. In the case of leukemia, in only 8 hours, about 100% of the cells that are cancerous are destroyed. Now, some doctors have a concern about using iron along with artemisinin. And the reason for that is because what we don't want to do is cause those reactions to occur in normal cells. And while that's a concern, that hasn't been shown to be a problem. And yet, because cancer cells tend to accumulate iron and infected cells tend to accumulate iron, the fear is that it could propagate the cancer or the infection as well. So that's something that we're going to have to probably wait on, although in a case that's really serious where somebody's tried every possible treatment that there is, from one point of view, and that's the fact that it's an FDA-approved drug, you could use it as a off-label use and still have an effect. But still those laws that are strict that regulate what you can do in cancer therapy, like in the state of California, need to be repealed. Now, artemisinin works in just about every kind of cancer, whether it be a prostate or a breast or colon or even tongue or even some sarcomas, which are notoriously difficult to treat. We know that there are 3 different forms of artemisinin. You can have either artemisinin itself or something called artesunate or artemether. They can be taken orally or by suppository. They should be taken in pulse doses, which means it should be on for a few days and off for a few days, because the intestinal tract tends to not absorb it so well if you take it for long periods of time. And then above all, we need to know that it's safe. And in 4,000 people who have been treated with artemisinin, we have found that the safety profile is shockingly good. Sometimes that's what you see when you use natural products, as in the case of artemisinin. So we have something to look at here that could be a consideration, and anybody who's gone through standard therapy using surgery, radiation, or chemotherapy had a very poor result and maybe are in the process of dying within a short period of time. Therapies like these should be considered because they may be something that could save lives. And there are lots of anecdotal cases that are very interesting that show exactly that.